We need... Hey, everybody.
Well, hello
Hi.
there. Hi.
We need theme music. That's
We'll do the
what I
Batman
think.
song.
No.
No? Alright. So today, we are continuing our live feed for heart disease, because we had Valentine's last week, and some people broke their heart, and some people actually have a broken heart, right? Or hypertension. And so last week we talked about how we create hypertension, and we said when they say 95% of the time they don't know what causes hypertension, and we said, oh, that's a bunch of bullcrap, right? And we explained what actually causes it, the endothelium, the subclinical dehydration, all that stuff that we can talk about on the, that you can look back at the old video. What we didn't get to is how are we really going to change heart disease, how are we going to fix it? And I think I showed you this chart last time. It's in the slides. In fact, if you go to slideshare.net/Patrick Garrett 7, just the number 7, all 44 presentations are on there that I've done in the last couple of years. And this one is from the hypertension slideshow, and then there's also some really good stuff on the Cholesterol is a Myth slideshow. So, obviously I'm Dr. Patrick Garrett. You guys hopefully know me by now. And I do functional lifestyle medicine. So the whole goal of that is to say, here's what's causing disease, here's how we quit doing that, here's what we need to do exchange differently, and then do we just get rid of the disease or the chronic issues or that kind of thing. So my job becomes very, very easily all the way up to reversing genetic disorders, because I just figure out what causes it and then tell patients stop doing that. So kind of like every time I walk, my foot hurts. Turns out there's glass in my shoe. I'm the guy that says, take
Stop
the glass
walking.
out of the shoe. That's what the other doc says. So, and then we have the great Holly Hajaj.
Hi, I'm Holly Hajaj.
Hajaj.
Here joining you tonight for our talk about the heart. I'm the wellness director here at Family Health and Wellness with Dr. Garrett. And excited to be here. Talk about heart stuff. I have heart stuff. I have was born with a congenital heart defect.
No heart.
So this is interesting to me.
She was the Kanye West Heartless song, right?
Well, I sought Western medicine, and they cut my heart right out.
They cracked it open like that.
Because that's what you do.
And she got the first rhino heart in the country. It was a baby rhinoceros, and they took the heart out and they put it right in, right?
Right. I'm starting to grow my horn here.
That's right. Well, so what did you have?
Actually, I don't know if it's congenital or not. Is it an atrial septal defect?
Yeah, it's congenital.
It is?
Yeah. So you have a little valve that goes from the upper chambers to the lower chambers, and then you have one that goes to both chambers at the bottom. So since you're not taking air in through your lungs, that basically mom's pumping blood through you, so you're just kind of like circulating through based on mom's heartbeat. And then when you take your first breath, when you come out of the womb, it's supposed to close up those, it has a little sticky thing that closes over that with the pressure. And some people don't have that.
The sticky thing.
Yeah.
Oh.
It usually depends on how much crack your mom smoked while you're pregnant.
Mom, don't listen to that.
Like a little bit of crack or a whole lot of crack?
Mom, don't listen to that. So
then they just went in and then they closed up this.
Yeah.
Yeah.
Yeah. And I have a good battle scar to prove it.
Yeah.
So.
She always shows it off so she can brag about her heart thing.
Yeah. Yeah, I'm the one that wants the attention, right? Yeah, it's me.
Okay, so I had to get heart surgery when I was probably 20-something because my heart was so big and generous that they gave me a normal-sized heart because I was too generous.
I'm not sure I can breathe in here. There's something, a level rising in the office.
Okay, so with heart disease, we don't want to manage conditions in my practice. We want to fix those problems, right? We don't want to medicate it with supplements. We don't want to medicate it with medicines if we don't have to. We want to just stop causing it. So, in doing that, first we have to know what's the actual causes of most all the heart disease, and then what is the lifestyle change we can do to fix that. Okay? So, I made a little chart that we'll go through. And these are the true causes. Now, next month, we'll talk a couple things about cardiology here. But next week, not month, next week, which is a half fortnight. So, in a half fortnight, we're going to talk. So,
Right.
in 1 week, we're going to talk about how cholesterol causing heart disease is a complete myth. Okay? And so it should be mind-blowing information for anybody. And the statins that they have on people on are like so horribly dangerous. And we'll talk about how they can lead to Parkinson's, dementia, permanent muscle wasting disease, all that. Like they're an absolute nightmare. Those and proton pump inhibitors are by far my top 2 of the worst possible drugs you could ever take. So.
Okay. So, before we get into this, hi Katie, hi Brianna, and I see some other people are on too. Please comment. Please make jokes. Please insult this one as much as you like.
I'm very sensitive.
Right. So,
and if you have questions, put it on there too.
Yeah, serious questions, especially those burning ones, and there are no dumb questions. So please join us for our discussion. I will be trying to keep track of that.
Yeah.
So take it away, G.
All right. So there is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. There's about 14 things that we want to discuss that are true, actual causes of heart disease. So the first one is low omega-3s. Now, especially when it comes to things like arrhythmias of the heart, where it's irregular beats, so it should be lub dub like that. So it's actually the valves closing that creates the sound, and so both the atrials close at the same time, both the ventricles close at the same time, and that creates a popping sound, which is the lub dub heartbeat. What if you have lub dub, right? So you might have like premature atrial contractions, premature ventricular contractions, and irregular like atrial fib, that kind of stuff. So most of the times we see those reverse very, very quickly with some very basic dietary changes. One of the things you want to get rid of is just caffeine by itself. But the other part is when we talk about like omega-3s. So most Americans, based on the things that we eat a lot of corn-based meat and corn-based processed food, and that's a high omega-6. And the average American eats about 40 times the inflammatory omega-6s as they do the anti-inflammatory omega-3s. When that comes to cardiovascular disease, that's a big problem because the outcome means that you literally cause more cardiovascular inflammation with omega-6s, omega-6 dominant diet. You can cause hypertension directly, you can cause irregular heartbeats, and then more platelet aggregation, which means more heart attacks, more strokes, just because you eat corn-fed fish, chicken, and beef. And so that's not a big surprise, that's what we do, and we see huge rates of disease with that. So the omega-3s, that means grass-fed, grass-finished. That means wild-caught fatty fish from the ocean, not from the dirty, nasty runoff from the farmed lakes.
Back Creek.
From the creek. Or birds that are in a giant warehouse being fed corn, right? So, no, wait, I was going the other direction. Free range birds, yeah. So, when you do that, you balance it out. So, in nature, the ratio should be about 1 to 1. And when it comes to irregular heartbeats or changes in cardiovascular electric conversion, you have a nerve that goes from your spinal cord, or sorry, actually your brainstem, called your sympathetic, called your vagus nerve, right? And then that vagus nerve is from the mesencephalon to the metencephalon, the lower part of the brainstem, and then that goes to your heart and it says beat 60 to 100 beats through the sympathetics, right? And then you have parasympathetics. I gotta stop drinking martinis before I come, right? So then the sympathetics come from basically where you have a rib, right? So from the thoracics at the top, thoracics in the back, there's a sympathetic chain ganglion that runs on the very back just to the side of your spinal cord. And you can actually see it inside, like next to the rib cage. And that one actually stimulates the heart by sympathetic nerve response. So that's fight or flight. So those then go to your SA node, which is in the top atrial part of your heart. Then goes the AV node, which is between the top and the bottom heart. And then it divides into two sections called the bundle His. And then it goes to the big muscular part of your heart called the ventricles, which is Purkinje fibers, right? So it's supposed to have one nerve going into that one signal from the SA to the AV, split equally, and then go and contract at the same time. Mm-hmm. Same rate. If they run off of omega-3s, B vitamins, magnesium, calcium, potassium, and one of those things is not in the right proportion, then you disrupt the cardiovascular electroconversion or electrophysiology of the heart.
Can that happen any time of day?
Oh, absolutely, yeah. And people sometimes have it all the time. And the solution medically is basically they go in, they cauterize the SA node, and then you get a pacemaker often. But really, I have not seen one patient that had to go do that. Most patients, it's very simple things they got to change. One of the biggest ones is an omega-3 balance in the body. So omega-3, think lots and lots and lots of fish. Because fish, wild-caught fatty fish, has nine separate mechanisms by which it reverses cardiovascular disease. Everything from running the electricity of the heart all the way to the flexibility of the arteries. Like, it's amazing. And, you know, most of the world, 85% of people live near the coast of a country. But America, we mostly live in the middle, too. And out of all the things Americans eat, we eat about 2,000 pounds of food a year. 2,000 pounds. And if you compare that, like what we eat more coffee beans by pound than we do fish by pound.
Well, I would definitely believe that around here.
So we're great with anxiety, not so good with fish that's going to reverse heart disease. So we basically created. So that's one thing, right?
Eat your fish, folks.
Omega-3. The other thing is like flax and chia, though they're ALAs, they convert to EPA and DHA, which is omega-3s.
Are they as good a source?
Oh, well, they're super awesome, but they convert a little bit slower to omega-3s, so you're better off with omega-3s, either as a fish oil, but really just as fish. You want fish in your diet.
Okay. Some people are probably going to ask what your ideal dosage would be.
A fish?
Yeah.
One whole fish. No,
or just of the oil.
Yeah, so if you get like a Carlson's cod liver oil, you know, and say you want to like be aggressive, so you might take fish oils. So you want about 3,000 milligrams of omega-3s. You want to make sure that you take a brand that doesn't have any toxic ingredients in there. So like Carlson's, Nordic Naturals, that's a good one. Barlean's is awesome, but Barlean's is in plastic, so you don't want that. And then when you talk about the dosage, like the 3,000 milligrams, that's of the EPA plus the DHA that's on the back. So it might say 1,000 milligrams on the front, but really on the back it says 600 omega-3s. Well, that's only like a fifth of the dose that you need, right?
Yeah,
so
and in what combination for the?
It doesn't matter. So that's one thing. Like DHA to EPA, it doesn't matter. They're both omega-3s. They'll convert readily to each other. It's only the ALAs that take a little bit more effort to convert.
Okay.
So
Brianna is asking, what about krill oil?
Krill oil is awesome because it's very sustainable for the planet. So with krill oil, that's great. I mean, typically fish, you used to buy it in the oil, and so it's like super healthy. But then they sell the oil, so then they squeeze your salmon dry and your tuna dry, and then take that oil and sell it back to you. So krill oil is great. It's just a little fish, and you just something. What is a krill?
A fish?
Yeah, I think it's a fish. That's what Kansas people think krill is. It's a fish.
Isn't it?
I don't know if it's a fish. I don't know. Do I look like Captain Morgan? I don't know. I know what a striper is and a walleye. So
you can't know it all, folks.
Can't know everything.
Okay.
So yeah, krill oil, and some people they'll say like, oh, krill oil is superior, but really, therapeutic-wise, studies show that krill and salmon oil equally just as effective. It's just one's more sustainable for the planet.
Okay.
So omega-3s, and really fruits, vegetables, nuts, seeds, berries, legumes, greens, they're all omega-3 rich foods. So
Right.
there's
And
no
that
animal
doesn't mean
trying to-
all those things mixed up into some sort of processed cracker.
That's right.
That means...
Yeah, not nut thins necessarily, but eating actual nuts.
Right.
Yeah.
Right.
That's a good point.
Yeah.
So then we have two other things, or maybe three things here. So one is, we always talk about that Americans eat 160 pounds of sugar a year.
It's the food of life.
And sugar is more addicting than cocaine. That's why
Like I said.
I put cocaine powder on my cake and not sugar, because I'm going to be healthy. So, with high blood sugar, you actually create this end product called advanced glycolation end products, which is called AGE, which is awesome because it ages your blood vessels. You sound like you have something to say.
I
Look at
do.
that face.
We
She's-
had another question about fish oil.
We're past fish oil.
Can't we backtrack? Okay,
All
just
right,
real
this
quick.
one's
Dan says that he raises crawfish and eats fish all summer, but not in the winter.
Who is
Does-
Dan?
Dan Gordon.
Dan Gordon.
Dan
Oh,
Gordon.
Dan Gordon.
He says, does he need a supplement in the winter if he's not eating fish?
Dan's awesome.
Hey, Dan. Dan had another question about a link.
Crawfish or mud bugs? He raises them?
He raises crawfish and eats fish all summer, but not in the winter. Does he need to supplement in the winter?
Oh, that's a good question. So you always need a steady source of omega-3s. Now, you're going to get those through nuts and seeds also, fruits and vegetables. But yeah, you should probably eat fish in the wintertime. So the deal is, and I can't remember where Dan lives, but like in Kansas, wild caught is always available in the freezer section. And so, to make sure to eat that all year long.
Or he could supplement.
Or you can supplement. Yeah, you can. Absolutely.
Okay, so it's not like if you eat fish all summer, it lasts you through the winter.
Right. Now, vitamin D is one of those things you build up, peak in summer, and then you use it through the winter. But
Oh, really?
Yeah.
I didn't know that. Okay.
Yeah,
So you can build some things up.
that's right. That's like all
Like your
summer, I build up my
What? Like his ego.
No, that's not true. So then, with sugar,
All right,
those-
age. Back to age.
those glycolation end products are what destroys the blood vessels, those very sensitive capillaries, and then that decreases blood flow to nerves, which then can cause these pretty significant neuropathies for patients because they're not getting blood supply. But also, it ends up damaging blood vessels to cause either hemorrhages or clots, which then stroke out people. Because as that damages it, we don't eat the things that then repair blood vessels and clean out blood vessels, so it becomes accumulatory damage.
It's great to know that there are ways that we can reverse that. Let's say
Oh,
someone
yeah.
already has some significant age.
Yeah.
Age.
Aged blood vessels, yeah.
Can you reverse those things, or is it permanent when vessels start to crystallize and whatnot?
Yeah. So, we had a couple patients now that have come in with their own Doppler studies on the carotids that showed a little bit of plaquing, and then did treatment, and then when they got it done, like 6 months later, maybe a year, all of it was clear.
Really?
Yeah, so it is, basically, we all know that you can always deplaque arteries. But to have someone come in with pre-Dopplers is awesome, and then have the post done, that's great. So you prove out what you did. Otherwise, it's ginger.
But what about the neuropathies? No?
Well, so to restore it, but also you need B vitamins for that. But yeah, you can
Okay.
restore that to where they don't have the neuropathies anymore. It's a little bit harder because you're dealing with decades of damage. But every cell in your body is no less than 10 years of age, or so, no older than 10 years of age. So you always have the ability to regenerate and rejuvenate your cells or pass on damaged cells.
Yeah.
So ginger, turmeric, boswellia, quercetin, rutin, root vegetables, greens, brassicas, those all scrub your blood vessels to clear out damage, debris, plaquing. And one of the things we'll talk about in a little bit with fibrinogen, which is part of that scarring process of the blood vessels, is proteolytic enzymes. And so literally, if you eat the core of the pineapple, it is high in bromelain, which literally breaks up scar tissue in the blood vessels.
Scrubbing bromelain.
Scrubbing bromelain.
Yes.
And then same thing with papain from papaya, or serrapeptidase, or serratiopeptidase, or nattokinase. Nattokinase is one of my favorite ones.
Is it?
Yeah, because nattokinase, they use fibrolytic units, so on the back it says FU, like 100,000 FUs. Like, I freaking love that. That's awesome. That's almost as good as the methyl tetrahydrofolate reductase acronym.
Right.
But you literally, Rob Lowe says it on Parks and Recreation.
Oh, okay.
That is literally my favorite thing. So, what are we talking about?
Literally scrubbing.
Scrubbing bubbles of fibrolytic enzymes.
Yeah.
So, nattokinase is one of my most favorite ones to prescribe, because nattokinase is actually made from bacteria that turn soybeans, organic ones, into a thing called natto. And natto is like, you'll see people eating it, you should Google image this, but they're eating like edamame that's fermented, and it's like cheese coming up. Like, they take beans and make it into this cheesy thing, and people either love it or they hate it, but I have not been brave enough to try it yet. So, I would rather buy the supplement.
Okay.
Yeah.
Okay.
So if you buy the supplement, when that nattokinase goes into your blood system, it literally breaks up and seeks out something called fibrin. And then fibrin is what we use to make scar tissue. So if somebody's shoulder hurts, they can actually do that and it'll dissolve this. But if you take enough, it'll go scrub all your old damage away, which is awesome. So then you can see the blood vessels return or become more patent over time with that.
Great.
It doesn't take all that much time. And there's tons of research out there as far as like nattokinase deplaquing arteries, so better than a stent.
Yeah.
Yeah.
Yeah. Okay.
So then back to
real quick though, if someone has say they find out they're blocked and the doctor's suggesting a stent, like how soon do you see these results with supplements and supplements and foods? Is this something that now obviously people need to take? You need to take your primary care physician's advice, right?
That's right.
If you're in the middle of that,
never go against advice.
I mean, what is the time frame?
So I don't know. It's in the research, but so I don't know it per chance. But the few patients that we've had where we've had pre and post Dopplers, it was like 6 months in between. So typically, like when I prescribe it, I'm looking at 3 to 6 months of treatment with that before you'd even reevaluate.
Okay.
Although it may be within a week, but I don't know. It's more of a prolonged thing because it has to go everywhere and it searches for fibrin, scar tissue in the blood vessels, but in the muscles, ligaments, all those injuries that you had as a kid.
Yeah.
All that stuff. So
I'm just trying to help people make decisions if they need to.
But yeah, if you're doing nattokinase, you want to do it more long term. If someone has a stroke or heart attack, they definitely want to do that, unless it's a hemorrhagic one. But as long as it's worried about clots, that's your clot buster.
Okay.
But even green tea is a clot buster. That's the cool thing. Shaoxing University did this study and it showed that green tea, 1 cup of green tea, had as much effect on reversing or preventing clots as 1 baby aspirin at 81 milligrams. And so instead of the baby aspirin killing your kidneys and 70% will end up with a GI bleeding to at least within the next 2 months, green tea is only going to make you smarter, reverse genetic conditions, and bust clots.
You just can't go wrong with green tea.
I know. And the Swedish University of Awesomeness, I can't remember which one that is, but it's in my food medicine one. But I would like to go to Sweden to validate this. But they showed that fruits and vegetables were just as as clot busting as aspirin also. Which is pretty cool.
Yeah. It's so powerful, just changing your diet and really committing to it. I think that's more powerful than people give it credit for.
Oh, yeah. You know, most people look at heart stuff as like, oh, it's a fatal thing and it'll get better. Only if you live in America and do what Americans do, right? Because your risk of a heart attack drops 70% if you go to Europe. 70%. Even if you go to Poland, it drops by 60%. Poland!
Question.
Yes.
You said natto? Like tofu?
Well, yeah, so natto is natto, which is
Okay.
the cheesy, it's not like tofu. Tofu's fermented, but not fermented to the part where it becomes cheesy. So you basically have edamame to tempeh to tofu. Or no, tempeh is partially...
It's fermented.
Yeah, tempeh's fermented. I don't think tofu's fermented.
Right, I think we've had questions about
But
that.
you can buy fermented tofu.
Make sure it says
Oh
fermented.
no, that's sprouted tofu. Never mind. It's sprouted tofu. But you probably could. I've never seen it. But tempeh is fermented, partially fermented. So tempeh, that'd be a good question. Does tempeh have the natto in there? And I bet it does. Probably a little bit.
Okay.
So with blood sugar being elevated from eating 160 pounds of sugar a year, that's going to end up causing damage to the arteries, like direct damage to the arteries through end products, right? But there's also, if you have high blood sugar and you run out of places to store it, which is 1 out of every 2 Americans now, then the sugar builds up, but so does insulin. And insulin building up in your blood is just as damaging as the sugar too. So a lot of times if someone has some issues, they might want to get an insulin test done, fasting insulin and fasting blood sugar or A1C, and see how much of that stuff is floating around, so you know how aggressive you want to be with the reversing the type 2 diabetes. Yeah.
Yeah. Is pre-diabetes, is that real? Is that a misnomer?
So diabetes is like here, non-diabetes is here, and everything else is pre-diabetes on this continuum. And so 1 out of every 2 Americans is either type 2 diabetic or pre-diabetic. But it is not a disease at all. It is a normal, expected outcome for people in a country that eat 160 pounds of sugar a year. Eventually, your cells have nowhere to put that sugar. You're not burning it off fast enough. And then if you do a blood test, it's all in the hallways of the blood vessels. And then we call it a disease. But we created that disease after 1950.
Yeah.
And so we went from 0% type 2 diabetes to now 1 out of every 2 Americans.
And pre-diabetes, is that the same thing as insulin resistance?
Right. So that's as your cells start to downregulate insulin receptors because it doesn't have a way to store the sugar, then the insulin builds up and that becomes insulin resistance.
Okay.
Yeah, absolutely. And it's very, very damaging. So if you're worried about cardiovascular disease, at least, like once or twice a year, you might want to get an insulin test done, a fasting insulin, to see if that's elevated or not. Same fix as the blood sugar issue. It's still just a storage problem.
Yeah.
But
yeah.
and then with the extra blood sugar, so if the sugar's sitting there in that blood vessel, the body wants to try to get rid of it because it doesn't want to cause cardiovascular damage. So it'll convert it by triglycerides to make fat.
I was going to ask what triglycerides were. Okay.
Yeah. So, it's triglycer, so it's 3 sugars, and 1 fatty acid.
Okay. When someone has high triglycerides...
No, I don't think that's right. I think it's 3 fatty acids on 1 glycerol.
Yeah.
That doesn't sound right either.
I'll look that up for you.
I did pass my board, so don't worry about that. It's in a book.
But okay, so when someone has high triglycerides, my mom had high triglycerides at one point.
Yeah.
What does that mean?
That means you're consuming so much sugar that you don't have places to store it, and it's trying to convert it to fat.
So the body is producing those in order to convert it.
Right. And so if the triglycerides are elevated, it basically means you're consuming more sugar than you can even convert to fat.
Okay.
Yeah.
Okay.
And then that becomes a big issue. So, next week when we talk about why cholesterol does not cause heart attacks, we will talk about real, actual factors that can lead to heart disease. But triglycerides is one of those. Because, again, it goes back to blood sugar, which goes back to advanced glycolation
End.
end products, age. And then that actually damages blood vessels.
This is really, really great. We talked about it a little bit last time too, but it's really great to know about the sugar connection, because it has been a myth that dietary fat was
Right.
the cause of blocked arteries and heart disease.
Yeah, healthy fat cures it. Inflammatory fat helps cause it. But fat by itself does not cause it. It's not the fat, it's what the animal ate to create that fat that becomes the problem.
Okay.
Yeah. And then on here, we talked about that, low vitamin D. I had a patient today that was taking 50,000 IUs of D2, which I think is ergocholecalciferol, which is synthetic, which is damaging.
Oh, really?
You don't need 50,000 IUs of vitamin D, but if it is, you want D3, not D2.
I thought you could make 50,000 IU if you sat out in the sun for 15 minutes.
Straight up. I'd be making 50K every day during the summer.
50K.
I'd be taking my shirt off, getting all that vitamin D. So
I do feel immediately better when I go out into the sun. Like, it is really noticeable, the difference.
Right.
Truly, with just 15 minutes. I kind of, if I don't have a lot of time, I'll be like, okay, I've got 15 minutes, what can I do? And I sit out there, and I can't tell you what the difference is afterward in how I feel.
What do you do out there?
Bask in it like a goddess.
You'd be rolling that the vitamin D. Your body would be like, we're making vitamin D. We're making vitamin D rain in this body. So
I did have low vitamin D once, so I was diagnosed with that. So anyway, go on.
So vitamin D comes from cholesterol. So again, cholesterol is awesome for you if you want vitamin D. And studies show that you can create, 4,000 to 40,000 IUs of vitamin D within 15 minutes to an hour of direct sunlight between 10 and 2. Okay. So what that means is that a couple things is three things. If someone takes a statin, that blocks cholesterol. Vitamin D is made from cholesterol. You should have low vitamin D. You should feel like crap, and you can get hypertension from that or heart disease. If you wear SPF stuff like oxybenzone, right? That benz in there is benzene, which is gasoline, which like quadrupled skin cancer once we started using that. That blocks the sun rays, which then blocks UV from helping stimulate ketocholecalciferol from being created from cholesterol in the skin, and then it goes to the liver, and that converts it to 25-OH, and then it goes to the kidneys and makes the final bioactive product of vitamin D, which is 125-OH. So if people have kidney damage, liver damage, there might be an issue, but really it's just not getting enough sunlight for most people.
Do those sun lamps really work?
Oh, yeah.
They do?
In theory. So I read the research. I don't know for sure. I assume they do. I tell people to use them, but we haven't done pre and post vitamin Ds with those. If you guys have had experience with those, please let us know on the feed. But the studies seem to show that it does work. It gives a full spectrum of light. People are happier, especially when you live up north. I have lots of patients that are up north, and they have low levels of sunlight, like in Seattle. So they get these little portable lights that then help make vitamin D, and then they feel better.
Dan was saying he read a Harvard research study that said lack of sun in the winter is the main cause of the flu. Is that correct?
Yes. Well, it's Harvard. What do you think? Harvard,
you
right?
Still got to think for yourself.
I did my lifestyle medicine coursework through Harvard. Harvard's the shizzle, man.
So now you think you're better than everyone else?
I think Dan's awesome for quoting Harvard. That's how you shut down the argument, is you say, Harvard says. So no, that's a big consideration, because if you typically what you do is you build up vitamin D, and it stores, because it's a fat soluble vitamin, and it stores up during the summer to peak. And then, just like money, I make all my money in the summertime, and then when the light starts to become lower, I start spending that money, and then spring, I start going back outside, and I just keep doing this. So, like, when they say vitamin D should be like this across the board, that is not true at all. That's not supported by physiology. Maybe if you lived in the Sud de France, and you went out in the sun, and you basked in the glory of living in an awesome place near the equator, that'd be awesome. Well, that's not equator.
No.
Costa Rica. If you lived in Costa Rica, it sounded better than Sud de France.
Right, because you had the accent.
La Marseillaise
Right.
pour Joseph Rouge de Lille. So,
Right.
I don't know how to speak Costa Rican. So,
Yeah.
if you lived in Costa Rica and you're always in the Playa de
Azul.
Azul, yeah, see, I guess I do know how to speak Costa Rican. Then, you should probably have a pretty steady vitamin D rate. But for us in Kansas or up north, it should peak, use it. Peak, use it.
I can see it being a factor in making people susceptible to the flu. Is it a direct cause? That would be.
Oh, the flu?
Yeah, the flu.
No, because flu is caused by virus. So basically, what Dan's saying from Harvard is when you don't get enough vitamin D because you don't get enough sun, because you live in your mother's basement, you play computer games all the time, and complain about your cat and why you don't have a girlfriend, then your immune system is suppressed. And
Okay.
then your mom kicks you out, and then you have to go get a job, and you're out in the sunlight, and then you don't get sick anymore.
And every case is like that.
That's every case. So, but that also means that people who take statins should get sick more often too. Yeah,
Yeah.
that's right.
All right.
They should be sad, sick, and have heart disease because they won't go out in the sunlight.
Here's the thing about statins, for sure.
Mm-hmm. Next week.
Next week.
So what's the third thing? Sun, statins, SPF. Oh, that was all three. You gotta get out in the sun.
Get out in the
Get
sun.
the hell out of the house. Yeah, so that peak thing. So you really want, if you test vitamin D, you really want to test it during the peak of sunlight exposure. But you know, in Japan, where it's all, and even the Eskimos, you know, they're always dressed up all warm, and they have just that exposure from the hands and the face is enough to cause enough vitamin D to be produced.
Yeah.
Yeah, so that's good.
Yeah, it is.
All right, so vitamin D you need. That's equals sunlight. Now, if you take D, which you shouldn't take, you should go out in the
Some of
sun.
those fish oil supplements have D in them.
Well, yeah, it's like 600, 800 IUs of vitamin D is naturally occurring in fish oils.
Okay.
But otherwise, D3 is made from lanolin, which is sheep's wool, which is a great substitute for like petroleum jelly or something like that. And that actually is a healthy D3. If you take D3, then you want to take at least 5,000 IUs of vitamin D. So, like, you know, if a patient has low vitamin D in the winter in Kansas, okay, fine, take some vitamin D. Summer, do it the hard way, get outside, right?
Yeah.
So, you know, I don't worry too much about that. But vitamin D3, 500 IUs a day. But you don't want to do really big doses at all, because then you might have a risk of vitamin D toxicosis. Some people, you know, if you do more than 5K, you might want to do K2 with that. And so they have combination ones, or you have to take two more supplements, or take two supplements. See, and that becomes a thing of like, I don't want to go out in the sun, so now I got to take vitamin D. If I take too much, then I got to take the K2, and then blah, 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 then you on a bunch of supplements to go outside.
Right.
Gotta go outside.
Right.
All right.
Okay.
Then we have high homocysteine. And homocysteine is part of like my favorite pathway in the body. Because homocysteine through B12 gets converted to methionine, which then gets converted to SAMe, which then gets converted through folate to S-acetylhomocysteine, which then through B6 gets converted to glutathione. So it means regulating DNA, mood and sleep, brain function, memory, and detoxification of the body. Like this awesome pathway. But if homocysteine builds up, it's a true cardiovascular marker. So there's two that are absolutes that you have to test, and not all doctors test that. We do, but not all of them will, but they should. And that's homocysteine and cardio-CRP, and we'll talk about cardio in a minute. But homocysteine buildup actually damages blood vessels. And since 50% gets converted to methionine through B12, then we're not getting enough B12. And where do we get B12?
When we pray.
That's exactly right.
From books.
You got to pray to the bacteria in your gut.
Probiotics.
Probiotics. So you knew it. So your 750 species of bacteria that live in you and on you, over 3 pounds of your body weight, are supposed to make ample amounts of B12. And then that B12 that's produced and absorbed in your blood converts homocysteine down so it doesn't cause cardiovascular disease. It then makes methionine, and then you regulate DNA out of that, and then your genetics are better.
What causes the high homocysteine again?
Not enough B12.
Not enough B12. You said
Yeah.
that. Okay.
And then the other part of that is B6 is going to convert the other half of homocysteine to keep it balanced. And basically with B6, that comes from beans, greens, and fermented foods, which is not what Americans eat. So even like folate, that converts into the S-acetylhomocysteine, makes phosphatidylcholine, phosphatidylserine. For memory and brain function, that comes from like if you eat like a cup of lentils, that'll be like 90% of your daily folate production. Like that is true, actual brain memory food is lentils.
Really?
Do you eat lentils?
I have not had lentils in
God
years.
dang it! These people expect you to live in this.
Do you eat lentils?
You talking to a guy who ate cricket flour candy bars. Cricket
Every
flour.
day?
No, I ate two. Just to say I did.
So lentils, we need to all start making lentils.
More lentils. And lentils are the best because they're dirt cheap, and they're the only dried bean that you can make a soup with or a stew with, and by the time it's done, the lentils are soft. You don't have to pre-soak them like you do fava beans or garbanzo beans or...
I'm telling you, if you want to eat a healthy diet, you should eat Indian food.
That's racist.
That is not. That is so not.
What?
Indian food is so delicious and it has all of these things in it.
You mean Native American food?
No, India, from India.
Next door, there's Mumbai Passage. What is that place called?
I don't know. I
have
haven't
an
been
Indian
there.
restaurant next door to me.
But you've got the herbs and the spices.
Yeah.
You've got
oh, good Lord, yeah.
all the beans,
Yeah.
the vegetables, the
Right.
mixture of colors. You're doing rice most of the time, right? I'm assuming
Yeah.
some of you people are more familiar with
Black
these foods.
rice, red rice. Well, they use that.
The turmeric is
That was jarninadine or something like that.
I don't know what that is.
Jarinin? What's the rice over there?
Jasmine, right?
No, it's jarine.
Basmati?
No, yeah, it's basmati. But what's the jarine thing? Jareen?
I don't know. Does anybody know what he's talking about?
I thought you knew because you eat Indian food all the time. I just make curry all the time. All right, so except kebabs in Wichita on Rock, that place is dynamite, and Zaytun.
Yeah.
Oh my God! All that food should scrub
That's that
all
good,
your arteries.
Yeah, good Iranian food, Pakistani food there at Zaytun. Yeah.
Zaytun's dope.
Yeah.
I love that place.
But there's just so many of those really good foods in those.
Except they only
you
have
can't go wrong.
Persian tea. I asked for green tea, and they go, "This is Mediterranean." And I was like, "We have Persian tea."
Yeah.
I was like, "All right, I'll drink
Do
Persian
it.
tea."
Persian tea's good.
But Persian tea's black tea.
Yeah.
Right? So it's good.
I don't know.
I don't know.
So.
So, that homocysteine can be lowered by either taking, coenzyme B complex, or you like a Country Life, or you can take like methyl B12s under your tongue. Those are great. So, actually, if you take methyl B12 or coenzyme B complex, you'll be like feeling dynamite. My voice cracked a little bit. I think I'm going through puberty.
Dynamite.
Dynamite!
Congratulations, I'm glad.
I started puberty.
He got the beard first.
I got the beard first, then my voice cracked. So then there's low free testosterone, right? And so typically with this, there's several talks we did before about hormones, and there's charts that we explain all this in. But two things with low testosterone. Is one, testosterone is exhausted through stress. We're the number one country for anxiety, number one for depression. Yeah, we should have exhausted testosterone by the time we're about 35, 40 years old. The other thing is testosterone is also cholesterol. So if we take statins to lower cholesterol, then we'll lower our testosterone, and that's a big issue.
I have a friend who is supplementing with testosterone.
Oh yeah, if you supplement with it, even the bioidentical,
Uh-huh.
you will downregulate your own production, and it'll turn you into a woman. So he'll start crying, watching Sex and the City.
Grow a uterus.
He'll be more of a Carrie than a Samantha. That's John.
We have a mutual friend.
And
She's
Sonia.
going to be so proud he remembered that.
That's right.
Yeah.
I'm more of a Carrie. Because I like to complain a lot and talk about Mr. Big. Is he going to marry me? That's the whole show. Okay, so then...
It's going to be okay, folks. We will get back on track, I promise.
So then we have the other part to that, which is the high estrogen. And when we talk about high estrogen, you have 3 estrogens. 2 of them are estrone and estrel. Men and women both have those. And estrone and estrel are weak, and they should be dominant unless you're going through puberty. So for guys, always dominant. For women, dominant, and then go through puberty, then go back to normal. And then you have E2, and that's estradiol. Now the estradiol is the damaging one. And that one becomes a problem when you look at things like dairy, which is astronomically high in estrogen. So you should have more heart disease the more milk and cheese and butter you eat. Not because of the fat, but because of the estrogen component that naturally occurs because it's a 1,200-pound cow breast milk, right?
Mm-hmm.
Yeah. We should see, there's a 1,200-pound woman, I think. We should compare her breast milk to a cow's breast milk and see if they have the same hormonal content.
I doubt it.
I think it's worth the study. I'm going to start filling out my paperwork. So
low testosterone, but high estrogen.
Yeah. And that's with xenoestrogens like plastics, shampoos, deodorants, lots of perfumes. Those are high estrogen content. And that E2 estrogen is what then is going to destroy the heart, which is why the Women's Health Initiative was stopped in 2005 when they looked at synthetic estrogens for hormone replacement. And the scientists said it was unethical to watch this happen to women during the study, and they stopped it.
Wow.
Because now they still prescribe it, but it was unethical to document it in the study. Because it depending on what they gave the women, I think it was the combo one, actually increased cardiovascular disease by 87% within the first year of prescribing it.
Wow.
So,
which contributes to that, to the idea that women, it's the biggest contributor. It's the biggest.
Yeah, because more women
disease
have heart
forming.
attacks now than men.
Yeah.
Yeah. Because you guys all have to be number one.
He's all about competition.
Mm-hmm.
Why don't you help men pull ahead?
We should consider having more heart attacks than women. We've got to get back to number one. Actually, men have more prostate cancer than women, so that's pretty good. We're still number one with that.
Are you?
America!
You should feel good about that then.
So then there's nitric oxide. And actually there were studies done in Australia where they compared or tried to figure out whether it was vitamin D from the sun or was it nitrous oxide from the sun. And what they found out was it was actually nitrous oxide dilates the blood vessels for reducing hypertension in the sunlight, not the vitamin D. So, when you eat arginine-rich food, which especially is lots of nuts and coconut oil, there's lots of arginine in that, even Jell-O, right? And that arginine then stores nitrous oxide in your tissues, and when you go out in the sunlight, bam! Nitrous oxide is released, and your blood vessels dilate, and your blood pressure goes down. So when you go out in the sun, you feel good?
Yep, I do.
It's not just vitamin D, it is literally lowering your blood pressure. So.
Wow.
Yeah.
If someone's having a heart attack, should you then get them out in the sun?
I drag them out in the sun, and I'm like, don't worry about it. You'll be fine. And I give them some salmon and cram it in their mouth, and that omega-3 solves it.
And then leave them.
I leave them. Yeah, I wipe my fingerprints off, and I just take off. So then we have things like low vitamin K, right? And low vitamin K, where's K?
Nobody ever talks about K.
K. I know. Everybody talks about the B's, but nobody cares about the K's.
Right.
So
B's
where do
and
we
the
get
D's.
where do we get K's from?
Um,
I think K is the last letter in the vitamins.
Carrots.
Yeah. K is for carrots. A is for arginine. No, it isn't. Right?
K
So-
is for carrots.
K is from greens, yo.
Okay.
Right? So
I'm learning, yo.
greens
Greens.
are not only full of B vitamins, which lower your homocysteine levels, but the vitamin K comes from those greens. So lots of dark leafy greens, not iceberg lettuce, but
K
dark.
for kale.
K for kale. Booyah. I knew you'd catch on.
Right. I do know how to spell.
And K for shard.
No, that's C.
And
K.
dandelion creams. Way off on that one. All right, what do we have next? We did that. Oh, oxidized LDL. So we only have a couple more. On cholesterol, we said none of cholesterol causes heart attacks. In fact, if you have high LDLs, they're like, well, that's bad cholesterol. And it's like, oh, really? Did God make bad cholesterol? That doesn't make any sense, right? And it's only bad if you're in America, but if you're over in Europe, suddenly LDLs are saving people's lives? It doesn't make any sense, right? So the reason is because you have different size LDLs. The large LDLs are actually cardioprotective. So if you do that VAP test, which we'll talk about next week, you can actually differentiate these out. And you can have high LDLs and high cholesterol and be most cardioprotective because of that. So the small LDLs, which we'll talk about next week in detail, I mean, they're just repairing damage. They're not even causing it. But the oxidative LDLs mean that we don't have enough antioxidants.
Okay.
And that's like your cataracts, your glaucoma, your what's that other one? Oh, macular degeneration, aging. But your blood vessels need antioxidants too, so that they can stay nice and resilient. Supple. So, where do you get antioxidants from?
Berries.
Yeah, like berry manilow.
Colorful foods.
Colorful food, yeah. So, eat the
Colors of the rainbow.
Rainbow, that's right.
The taste of the rainbow.
Like Skittles, right? Like Skittles?
Yeah, go out and eat Skittles.
Skittles.
No, don't.
Nature's
Skittles.
Skittles are
Berries.
berries. Yep. So, the darker the berry, the...
More antioxidants.
Yeah, all right, then more antioxidant. In
I'm
fact,
trying.
even with rice, brown rice is really good. White rice, just sugar. But if you do red rice, more antioxidants. If you did black rice is as antioxidant as blueberries. And there's an awesome book called Eating on the Wild Side, and it is amazing reading that to see the difference of how much antioxidants are in wild varieties versus what we eat on a regular basis.
So pick whole, natural foods with color.
Mm-hmm. That's right. The darker, more rich colors. So sweet potato or purple potato or orange.
Versus white.
Right. Racism.
He's never going to let
So,
that go.
oxidized LDLs. Let me check that one off. That, right. And then we have low HDLs. So HDLs, we said there's no bad cholesterol, but there is like really, really good cholesterol. And really good cholesterol is high density lipoproteins. And those are HDLs. And those are one of those things that I love as a biomarker because you can't fake out HDLs. You can't fake it. You gotta live the lifestyle. And HDLs come from our wellness director, what is it? That's right, nuts and exercise. Or exercise nuts.
I love how I'm the prompt for the things that you know in your head.
She said
I'm doing my best, folks.
She said she doesn't get to talk enough on these. So I'm trying to think of stuff that she doesn't know, and then
You
and
could
how
have
do
a
you-
talk all by yourself and do really well. This is true.
how do you methylate that? I don't know. How do you synthesize a
Synthesize a
methylated
methylated
alkaloid?
alkaloid.
God
Yeah.
dang it.
Yeah, I already know that one.
What movie is that from?
So I could not tell you. One way, no way, no how.
Love Potion number 9 with
Okay.
Tate something and that other girl. So,
So low HDL.
So more activity.
So you want high.
That's right. You want
You
high
want
HDLs.
high HDLs.
And usually like 55 all the way to like 90 is awesome. Now, if you get the VAP test done, it'll break the HDLs into large and small. And the large ones, just like the large LDLs, are the most cardiovascular protective. But you will find small HDLs, and they're, again, protective, but not as much protective. That doesn't even sound right, but you get the point. I'm trumping it.
Yep.
The large ones are bigly better, and the other ones are smally better.
Ah.
And then we go back to our last thing. And our last thing is inflammation. So inflammation is the actual cause of most of the heart disease. Inflammation is the cause of all disease. Virchow said in the 1800s, that famous quote,
Oh, right.
God
That
dang it.
famous quote. Yes, folks. I've got it right up here.
So it said
I'm gonna-
all diseases cause by inflammation.
Oh, right.
But he said that-
before.
But that's also what he called the devil, was inflammation. And so then truly the devil causes inflammation, is what he was saying, because it's the 1800s, and they didn't know anything in the 1800s.
Ah.
They're like, the devil causes disease.
So sugar is the devil.
Sugar is the devil, and dairy is the devil.
And dairy.
So with inflammation, there's 2 cardiovascular markers that we talked about. Homocysteine, which we said lots of B vitamins, and then the other one's cardio-CRP. And C-reactive protein, the high sensitive is the cardio-CRP or high sensitive CRP. And that's something you should always get checked like once, twice a year. And if it's elevated, then you want to knock down the inflammation with anti-inflammatory foods, which means going back to omega-3 rich foods, grass-fed, grass-finished, wild-caught fatty fish, free-range birds. Like even if I was a cannibal, I would only eat like free-range people.
Hippies.
I would. Cats are free-range, right? Can I eat cats? Alf eats cats.
Cats are meat eaters.
I don't trust meat eaters. So,
So,
where does it take us?
have we talked a little bit, with each thing, we've talked a little bit about these good foods, and
Yeah.
we want to have low glycemic,
Nutrient dense.
nutrient dense, potassium rich, magnesium rich.
Yeah. Yeah, if you supplement, magnesium citrate with calcium in there, like Natural Calm that has both those in there. You want a calcium citrate, which absorbs like 66%, or a magnesium citrate. That often is enough to reverse the cardiovascular stuff, but again, it needs to be through their food too.
What about water? Have we talked about water?
Más agua. So, yo quiero agua, por favor. No? Alright. So with water, most people are drinking lots of caffeine because we're all stressed with lots of anxiety. 1 cup of coffee can deplete up to a quart of water, so we don't get enough. And with black tea, most people, 50 milligrams of black tea, they're eating drinking 4 to 5 times that in like a Route 44.
So just because it's a liquid that you're drinking, it doesn't mean you're getting water, right? Right.
That's right. That's right. So some are worse. I was gonna make a joke, but so like a Route 44 black iced tea might be just as diuretic as 1 cup of coffee, and so people are just constantly doing that. And so what happens is you will get what's called subclinical dehydration, which means your blood vessels have less volume, so they have to constrict, which then gets the blood up to the brain against gravity, which then can cause direct hypertension that way. So the cure for that?
Water.
Más agua. That's right.
Right.
In French.
Ooh, l'eau.
That's right.
L apostrophe E-A-U.
Well, plus l'eau. Oui?
Plus.
Yeah. Je voudrais plus l'eau. So, more water is going to give you that benefit. So, and again, I can't tell you how many patients I've had over the years because I have dementia. But their blood pressure was often corrected just by increasing their fluid intake, non-caffeinated fluid intake, by half their body weight in ounces of water minimum. Because when they do that, they actually restore that hemodynamics, and then they require less pressure to get the blood to the brain, and then the blood pressures are normal for the first time. So that's a very simple solution. So you want to summate all this?
Oh, yeah.
No, you summate it. All right, do it.
No.
Here's how
Let's do our takeaways.
Oh, man.
Let's do our
All right.
takeaways.
My takeaway... All right, go ahead.
No, you
Ladies
go ahead.
first.
I don't have mine ready.
Okay.
You go ahead.
If you want to have less cardiovascular disease, then you should adopt a sustainable lifestyle of the people and countries that have less cardiovascular disease.
Good.
Booyah. That's how you do it. Sustainable lifestyle consistent with life and longevity.
Excellent. Mine is, if you want to reduce your cardiovascular disease, come see Dr. Garrett.
I like your takeaway a lot better. Jesus. She's so smart. I like
Yeah.
that. That's awesome.
Yeah.
Yeah.
So.
Yeah, we like. I think we have like maybe close to 100% success rate on things like blood pressure and arrhythmia and that. I mean, there's tougher things that a lot years and years of damage. Like if somebody has cardiomyopathies or something, like their heart's all big and swollen because they're so generous, that might be a little bit more difficult. Or left ventricle hypertrophy or congestive heart failure, those kind of things. But most people, if they correct it, then they have created a lifestyle that doesn't require medication intervention, and that saves them money and time and concern, which is awesome. Yeah. All right, so next time,
cholesterol myth.
is a myth. Not that its existence is a myth, but the fact that it causes heart disease is a myth. And remember, you can get all these slides on slideshare.net / or / or / Patrick Garrett, Garrett, and then the number 7. So slideshare.net / Patrick Garrett 7. And this one's called the Cure for Hypertension or something like that. And the next one we'll talk about is the cholesterol is a myth. That slide's on there too. There's 44 presentations already on there that you can download, share, whatever you want to do with them.
Did you post the link on this talk?
No, I did not.
Okay. We had a question about a link being posted that someone
What
could
link?
share.
Oh, on ours?
We can look through we'll look through the feed after the talk.
Yeah, I can post the links to the slides too when we finish.
Yeah.
Any other questions, comments, concerns?
Yes. Requests.
I got told
always...
No, go ahead.
No, you go ahead.
I was called a hipster twice today.
And you were proud?
No, I don't know why I was called a hipster.
Your glasses, maybe. And the beard. Now you just need a man bun. And you need a man bun and some skinny jeans. And you
Oh, yeah. I got skinny jeans at home.
the perfect hip.
I'm a hipster.
It is long enough.
Yeah.
Yeah.
All right.
Okay.
So thank you guys for coming and watching. And please share this with your friends. Again, for a lot of people, this is life-saving information. And it's free and simple for most people to fix these things.
Yep.
All right.
Okay.
Bye, you guys. No, don't touch that. Not.